Hello, everyone, and welcome to another episode of Sounds Like Success, an Atlas IED podcast. I'm your host, Ben Thomas. Thank you so much for joining us. On today's episode of the show, we're beginning a Sounds Like Success mini-series on the importance, the use cases, and the challenges around mass communication technology in a variety of industries. But why bring this up now? Well, with one of Atlas IED's partners, Singlewire, a VoIP application company for emergency communication and mass notifications, we've been working to develop cutting-edge solutions around safety in daily communications. Today, we're exploring mass communication technologies for the healthcare space. Hosting the conversation today is Brad Jungemann, Southeast Territory Manager for Singlewire. And for insights, we're also joined by Thomas Ahern, Design Services and Tech Support Manager for Atlas IED. Thomas, great to have you joining us. Brad, looking forward to the conversation.
Hey, thank you again, everyone, for joining today. I look forward to speaking with you all and introducing my friend and co-worker, Thomas Ahern from Atlas IED. I'm Brad Jungemann from Singlewire Software. We're here just to spend a few minutes talking to you about what Singlewire Informicast and Atlas IED with their IPX line is doing in healthcare. So thank you, Thomas, for taking the time today.
Well, thanks for having me.
So Thomas, I know you're busy, a lot of things going on. People are back to work. This idea that COVID is kind of getting behind us and people are getting back to work and more of the operational day-to-day healthcare industry is back to the normal. What are you seeing out there? What do you see from projects in front of you today?
Well, I don't know if I could say that healthcare is back to normal. Certainly, and maybe some of the in some parts of the country, but a lot of parts of the country is still dealing with a little bit of influx. We're obviously on the way down, but that doesn't stop healthcare from growing, right? It's the one market that will always grow. If our population grows, healthcare grows, and with that, all the new technology comes right along with it, right? So that's what we're seeing. Is just more and more technology from the medical devices now all the way down to the paging systems and the other ancillary systems that are in the building. They're all getting an upgrade now.
Yeah, and Thomas, what we're hearing, kind of like what you're hearing as well, is just people trying to be more efficient with all of their systems. So this idea of Informcast with Atlas being able to do things like simplified paging, where an operator doesn't have to be on the handset making a paging announcement repetitively. They're kind of what I call the air traffic controllers of any healthcare system, and they're asked to do more with less. So if we can provide tools like, once again, Informicast with the Atlas IPX devices, that simplifies things. If they can just go to a dashboard, type a message, and click send and reach multiple devices, it makes their job easier. What do you see kind of being some of those trends in healthcare that people are focusing towards to add efficiency in their environments?
Yeah, a lot of the features and functions that we have between the two systems do exactly that. They help that health caregiver, the caregiver, with their daily workflow. So it's important when you're putting any kind of hands-on ancillary type of system like our emergency notification systems that we supply, that they're easy to use. You can make a page from anywhere. We don't want to impede on that healthcare worker's day. We wouldn't want to make them, hey, you have to go back to that central area to make a page from the microphone. No, we want them to be able to page from anywhere, whether it be the phone, their mobile device, or a local microphone. Real important that we contribute to less footsteps for the caregiver, because as you said, they are doing more with less, like a lot of markets and a lot of folks are nowadays. So helping with that daily workflow is a big key, and a lot of our components can help with that.
Yeah, we had a couple of clients come to us this year, and we worked together on these projects where they wanted simplified ability to notify people on a regular scheduled interval and at large healthcare environments. So our ability between our two systems to essentially schedule notifications, things like, are you washing your hands? Are you wearing your PPE? Are you doing social distancing during this time frame and so forth, can be configured at a global level. A lot of these facilities are still having their operators getting on the telephone, making those announcements, having a little clock and reminder for every 30 minutes to do this. While in software and with the Atlas hardware, we can do those things in a few seconds. They can control it globally. One person can record one message, and if you have 10 sites, 100 sites, you can program that all systematically from that standpoint as well. What types of devices? I know, we do so many great things in the visual notification with the IPX devices and the color changes. What do you see really being the strengths between our two systems from that standpoint with the color notifications?
Well, certainly, no. Hospitals are built around priorities: code blue, code pink, code yellow, right? So being able to relate our devices, our IPX, to match the different codes that the hospital has. So when there is a code pink or a code silver or one of these other codes, we can match the color codes on our IPX screens with those emergency messages, whether it be a canned message, pre-recorded, or live messages that's going to include some text or some other information on our displays. So visual notification is right up there with audible notification when it comes to alerting folks. So, that type of interaction with the folks in the building. And we got to remember, healthcare facilities, these are very public buildings. So it's not just about, the patient to caregiver. There's people all over the building that we have to notify in different manners. Having the different priorities becomes another way of helping that daily workflow.
That's awesome. No, I think there's so many great things we can do, so many other great things we can offer between our companies, and just out there to educate people on what our capabilities are is really a goal of ours, I know, together, and we've done some great projects together. So appreciate the support and everything you've done for us, and look forward to tackling a few more projects in healthcare together.
Sounds good. Thanks, Brad.
Thanks, Thomas.
Thank you both for joining us today on Sounds Like Success, presented by Atlas IED. If you haven't subscribed already on Spotify, Apple, or Google, do so to get the latest episodes. Thanks so much for joining us today, and we look forward to hearing from you next time.